Yes, so the next group is from the Autistic Communications Tool for Primary Care Act. And you. All right, so we've got Jennifer Kirton, a lecturer in the Doctorate of Clinical Psychology program and researcher focused on improving healthcare experiences and communication for autistic patients. So next we've got Thomas Mohaupt, and from the Department of Mathematical Sciences, and has been involved in autism research since being diagnosed in 2013. And then we have Kate Buchanan, is a GP and a community clinical teacher at the University of Liverpool, and works at the Alderhay Assessing Children in Care. And you all have a poster today as well, is that correct? So everyone, have you guys checked out the posters? Definitely recommend if you haven't. Very well done. Okay, so I'm gonna hand it off to you two as well, okay?
Okay, thank you very much. It's going to confuse me. There's two things to hold. We're going to swap.
Stand like this.
Stand really close together. Okay. Okay, so thank you very much for giving us some time today. I want to just spend a moment at the beginning of our presentation to just kind of acknowledge everybody that's been involved in this project. We're talking about the Autistic Communication Tool for Primary Care that has been developed as a participatory research project. It's an idea I had a few years ago, but actually where we are with the project now is absolutely down to the people that you see on screen. There's three of us here now, but actually the dedication, motivation and just passion and experience that the team has put into this has completely shaped this project and made it really enjoyable to work on, but hopefully going to make a big difference. So quick introduction from me. I'm Jenny Kirton. I'm a lecturer on the Doctorate of Clinical Psychology programme, and I have been working in autism research for about 16 years now.
That's true. I'm Kate. I'm a GP at a Brownlee Group practice, which is very close to here, and we obviously have a lot of students registered with us, and I also teach medical students here at the university.
My name is Thomas Mohaupt. I joined the Department of Mathematical Sciences in 2005. I'm now a reader in theoretical physics. So, as mentioned, since being diagnosed, I've been interested in involved with autism research. Until 2 years ago, mostly at places outside Liverpool, but I'm very happy that through the Neurodiversity Staff Support Network, the Autism Hub, and our developing unique approach to participatory research, I now have opportunity to contribute here in our university.
So I'm going to start by telling you a little bit of background of why this project has come about. We know, unfortunately, autistic patients, they have much worse health outcomes than other people. I have minimized this slide to try to not be a real trigger, but you know, autistic patients have the same preventable health care problems as everybody else, but unfortunately across pretty much every measure that has been researched, they have worse healthcare outcomes. And this isn't because of any other reason, and there's no predisposition apart from we know that there are links with a few medical conditions, but really a lot of the barriers come from accessing the healthcare system and, you know, communicating within healthcare systems and not having successful interactions. And this is not the fault of the healthcare system, although we're trying to adapt it, but we've tried to, with this project, come up with something that is really, really great for autistic patients, helps them communicate their needs, but also as well, it really supports clinicians. It's giving them the information they need to improve healthcare experiences for autistic patients. Okay, so some of the barriers that autistic patients can experience, which I'm sure you all know about, and we've been talking about a little bit today, is communication, different ways of communicating within the healthcare interaction, which is misinterpreted perhaps by a healthcare professional that might not understand. Also as well, the sensory environment The sensory environment can be very, very overwhelming when you're very anxious going into an appointment, and then you have to sit there in that waiting room. The anxiety goes up further. You're worried about your health concerns. So these can be real barriers. People have told us within our project that actually they've waited for this healthcare appointment for a long time, and they've got to the waiting room environment, and then actually it's too much and they've left. So these are the type of things that we're trying to look into with this project. Also as well, different expressions of pain, and perhaps clinicians not understanding that different way of expressing the pain. It's not a typical presentation that they might be looking for, they might be been trained to look for. And unfortunately, there's gaps in clinician knowledge that, you know, particularly in primary care, can't be experts in everything. So what we're trying to do with this project is give some of the information there in the consultation. So also contributing factors to these barriers is the fact that diagnosis isn't always visible on healthcare records. And like one GP said to us, even if it is visible, it doesn't tell me anything about that person that's actually coming into the room that I'm going to be talking with. There's more and more evidence how masking is a trauma response, and then, you know, it's not an intentional thing that people are doing within these consultations, but again, that makes it very, very difficult for a clinician to interpret perhaps some of the things that's been reported to them by the patient. And then of course we've got individual needs. We've spoken a lot today about how everybody's got different needs. Everybody, if you know anything about it, I've been working for 16 years in autism research. I don't know everything. I don't know everything about somebody that I meet. So it's those personalized things that need to be put into healthcare, which is very difficult. But all of these things kind of go towards a picture of people not going to healthcare services, or if they are, they're going to healthcare services late, so their condition is exacerbated, and this contributes to barriers. Sorry.
Okay, let me briefly guide you through what the tool is. So it's a personalized health tool, something with which as an autistic patient you can influence your experience in primary health care. For the clinician, it provides a concise summary of your needs. As a patient, you can prepare in advance, you can put down what your requirements is. This reduces in particular your cognitive load during the meeting in the GP practice, and therefore reduces stress. And it's designed, it's a co-designed for practice. No training is required, and it doesn't impose much of a cost and no extra consultation time.
Be helpful. Just
Right.
so technically.
Okay, so you can fill it out on the web page, print it out, two pages. Front side is for the care navigators. They get at the very front clear instructions, no training required. What has turned out to be the most typical issues, typically sensory issues, but also communicative issues, is available through tick boxes. And then there's a free text box for anything idiosyncratic. Most importantly, you can also inform about what your most likely stress symptoms are and give a clear message how you want staff to react if they recognize that you are in distress.
There you go.
Okay, and this is then the site for the clinician. Again, it provides a concise summary for clinic staff to give them the essentials to prime them for the meeting. As a patient, you have various fields to fill on. Let me focus on this one here. Why is the one about the issue so small? This also resulted from discussion and feedback, but the idea is to appreciate the reality of the 10-minute slot. So the patient is triggered and gets helped through the web page in preparing and filling out. So there's an explanation why you have to be concise. You have your own time to make up your mind what the meeting is about, can put it there. Then the clinician has the information that they need to manage the meeting. And also one which is particularly important for me, the closure, the outcome on the consultation, the next action by the practice, but also your next action as a patient, if applicable, is clearly documented. So no need to worry about this.
Okay, so we're hoping to use this tool at Brownlow once we've got the ethics through. And the plan is that this is a patient-owned tool. So the idea is that the patient will feel able to complete it at home, you know, when they're calm and they've got time to think and process what's important for them in the appointment. They're going to bring or we're going to get them to send the tool back using our kind of electronic system, and they can either bring it on paper, they can kind of show it on a mobile phone. We're going to hopefully attach it to the notes, and then obviously we're doing some kind of awareness with GPs, but also the reception staff, so that, you know, everyone who's involved in that patient journey is kind of aware that patients, you know, kind of might be using this tool to kind of make their needs kind of known. And then afterwards, of course, the bit I always find patients struggle with is when I kind of have a really long 5-step plan, you know, get your x-ray, get your bloods, come and see me in 2 weeks, go and get this medication, take it for 2 weeks. So the fact that patients can leave the appointment with a written down plan, I know as a clinician will be absolutely invaluable for patients. And that, of course, will reduce the health inequalities for them. Yeah, so we've had some just really positive, you know, kind of feedback about this tool. GPs don't really get much teaching on neurodivergence, and if they do, it's very kind of black and white, which, you know, we know that neurodivergence is more complicated than that. So as you can see, you know, just some really positive feedback, and also we're hoping to kind of demonstrate that this tool helps improves GPs' confidence at consulting with neurodivergent patients.
So how can you be involved? So how many people are Brownlow Health registered here? I just wondered. Oh, great, you're our target. You're all welcome to use the tool, but you can just visit the website and follow the instructions. You just have to put your email address in to the website. You complete the autistic communication tool, you know, in your own time. Use the guidance that's there for you and take it along to your appointment. Brownlow Health staff will be expecting it. They will be aware of what this tool is, and then complete the follow-up questionnaire. What we're going to do, and that's why we asked you to register an email, we're going to send you a questionnaire 2 weeks after you filled out the autistic communication tool, just so we can get some feedback. This is in development. It is a kind of tool where we are wanting to improve it. We are wanting to make it even better. So this is why we're doing the pilot. We have been told that, you know, this is something that's needed in other areas as well. But what we're doing is we're demonstrating that it's going to work with Brownlow Health, and then we can go to take it nationally. So we really need your support. But even if you're not Brownlow Health, please, if you feel that it would help you, please go and use it. We'll also invite you to an optional interview within the email, but it's very, very simple, and we won't take up much of your time. Touch it. That's it. Thank you very much.
Thank you so much. Very interesting.